My name is Teresa. I was an addict that was totally out of control, and I needed help.
Drugs had literally taken me nowhere. 4 incarcerations, totaling like close to 20 years in prison. We learned this place more or less got me on the right track.
You try to do it for mom, you try to do it for your children, you try to do it for your mate. But the only way that it works is when you do it for yourself.
I became active with drugs around 1989. Through all of that, I became HIV positive.
I don't think I would want anybody else to have the type of life that I had. It wasn't good at all.
One day I just woke up and I was tired of, doing what I was doing, so I wanted to seek some treatment.
Addiction Research and Treatment Corporation was the base of their beginning as well as start their new program. And I'm very proud of both of these entities.
It is very simple for us to dismiss individuals that suffer from addiction. It is easy for us in our society to turn our heads and our back on them.
Some people think that people just do drugs just to get high, and for some people it's true, for some people it's not. Sometimes you self-medicate when you have problems and pain, and that's what I was doing, basically.
The truth is that we all have to remember that addiction is an illness, and it is a treatable illness.
I started going to groups and conferences with my counselor and things like that, because the only ones I basically had in my life at this time, my daughter had started trusting me again.
It's a relief to be somewhere that people are concerned about you and care about you.
When a client comes into our clinic, they get treated as a whole person, and they get treated from every aspect of their lives that might be an issue.
We work with them in creating a viable career path so that they can become employed.
Basically give you tools how to live out there.
It's given me stability and independence, and fortunately I've been on a few other programs, but this one seemed to work out the best for me, and I've managed to stay clean for at least 3 or 4 years now.
We provide the mental health services to adolescents while they're involved with the New York City juvenile justice system. The average age range is from 12 to 16, but we've had as young as 8.
We had a lot of neglect, sexual abuse, as I was a child. So I started using at a young age to block all the pain.
I started with the hard stuff early, and I ended up stopped going to school because I was in high school at the time. I was basically just running the streets.
It is through START that I and my partner and I get to participate and support the most disenfranchised members of our community that might not be reached otherwise.
We experienced, like other not-for-profits, a reduction in government funding. We had to figure out how to do as much as we have done and even more with less. With all the things that we do well, individual group counseling, primary care, HIV care, family counseling, we had to make sure that we can maintain the integrity of that by focusing upon other relationships.
I personally give to START primarily because I know where my money goes. I know that my money and my contribution makes a meaningful and direct difference in individuals' lives.
Being a corporate sponsor, or just being a corporation in general, we have this responsibility to give back to our communities. To see what START was doing and the services they provide, not only do they help individuals recover from their addictions, but they also help individuals with everything else that's encompassing their life. By bettering that one individual, they can now go back into their community and be a better person in their family, be a better person at their job, be a better person overall, and see that powerful impact trickle down to those that are involved in their life and in their social circle.
START changed my life. It has enabled me to every day make a goal and continue it. I can't see a day without this program.
I saw positive people. I saw that there was people can change. START made me realize I could feel better about myself without drugs. It brought me and my family closer. There's more trust, more understanding, and I feel much better being drug-free.